Atopic eczema, a dermatology patient information tool.
Eczema, sometimes called dermatitis, is a common inflammatory skin condition caused by a dysfunction in your skin's barrier. There are many different types of eczema, like atopic eczema, which is a chronic inflammatory condition caused by reactions of your immune system. Seborrheic eczema, which is an inflammatory condition in areas where there is hair and oil-producing glands. Contact eczema, which is a skin reaction caused by direct contact with a certain substance or agent that irritates the skin. And stasis eczema, which is a skin rash associated with high blood pressure in the vein of the lower legs. The most common type of eczema is atopic eczema.
Atopy refers to a person's tendency to develop allergic conditions such as asthma and hay fever. It is influenced by genetic factors and environmental factors such as changes in climate, pollution, diet like eggs, milk, and peanuts, house dust mites, and pollen. Atopic dermatitis, also known as atopic eczema, the most common type of eczema, is a complex chronic inflammatory skin condition that results from an overactive immune system and defective skin barrier, resulting in dry, itchy, inflamed, and rough skin.
Signs and symptoms of atopic dermatitis. Atopic dermatitis often causes a red, itchy rash that appears as dry, flaky, and scaly. It commonly occurs where the skin creases, such as the elbow creases, behind the knees, and near the neck. The scalp and face and body might also be affected. The affected areas of the skin may develop small bumps and may cause the skin to become darker and thickened in those regions, and this is commonly in chronic eczema. In acute eczema, the skin is usually erythematous, wet, and weepy. Signs of atopy in children. These include muddy sclera, Denny Morgan lines, and allergic shyness, just to name a few. The risk factors of eczema include a personal history of any type of eczema, asthma, allergies or hay fever, and it also includes genetics, so family members that have or had eczema, asthma, allergies, or hay fever.
If left untreated, atopic eczema could lead to complications. These complications include infections as a result of the abnormal skin barrier allowing the entry of harmful microorganisms through the skin. It could lead to contact dermatitis as a result of the hypersensitive skin. It could lead to scarring from the repeated scratching and rubbing of the skin, and it could lead to adverse psychosocial effects. The adverse psychosocial effects of living with eczema may include daily activity limitation due to the excessive pain or itchiness of the skin. It may also cause emotional distress due to the challenges of living with eczema. The itchy skin or physical discomfort could cause difficulty sleeping. The patient's negative image of their skin may lead to embarrassment, decreased self-confidence, or overall self-esteem issues. Lastly, it may be associated with social stigma, as others may criticize the appearance of the patient's skin condition.
The pharmacological treatment of eczema aims to treat the inflammation with topical steroids. It also aims to restore the dysfunctional skin barrier and treat dry skin with emollients like emulsifying ointment, cetomacrogol, or petroleum jelly, more commonly known as Vaseline. Other treatments like soap substitutes, coal tar, and specific shampoos can also be used. Steroids have different potencies or strengths that indicate where on the body they should be used. Mild potency steroids like 1% hydrocortisone is suitable for use on the face. Potent steroids like betamethasone is suitable for use on the body, and high potency steroids such as Dovate are suitable for use on the body, but are not suitable for use on the face. Steroids can also come in different forms, like creams or ointments. Creams are used for wet eczema and in body folds. Ointments are used for dry eczema and on the thickened areas of the skin. The non-pharmacological treatments of eczema include the previously mentioned soap substitutes that can be used to ensure that the skin is not irritated with fragrances and preservatives. These include aqueous cream, moisturizers, or liquid paraffin instead of normal soaps. Patients should also have an allergy test done and be told to avoid any known irritants or eczema triggers. A few examples of known eczema triggers include certain foods like milk, eggs and peanuts, certain chemicals or fabrics, dust, animal dander, mold, insects, and emotional stress.